Hey guys, welcome back to AceTheAMC. Today we have a AMC style question on psychiatry. This question actually comes from our partners now, AceTheExam, which is a great new question bank that has thousands of questions both on the AMC. It also has other questions if you're studying for the RACP exam or the GSSE exam. We have both found that the questions are really in line with the AMC exam. We found that a lot of them match the questions found in the AMC MCQ handbook. And yeah, we'd strongly recommend checking it out. We know that there's plenty of other question banks out there, but we found this one to be really, really good. So we'll be running through some questions on here from AceTheExam, and we'll also do an detailed video within the coming weeks showing exactly how the question bank runs, and we'll go through a few more questions and answers and things like that within that video too. So without further ado, we'll go through this question. So basically, we have a guy here who is a schizophrenic and he's having violent hallucinations, and it's basically asking which of the following should be given to this patient immediately after a controlled environment for the safety of both the patient and medical staff is established. So we'll go from the bottom, ECT or electroconvulsive therapy. So this is incorrect, as ECT is usually for refractory psychosis or usually severe depression, wouldn't be used acutely in this situation. Lithium, this is incorrect. This is used for bipolar disease and usually has a slow onset. Olanzapine, this is also incorrect. Olanzapine is an atypical antipsychotic. It's usually used for treating patients with negative symptoms. This guy, however, is showing positive symptoms, remembering things like hallucinations, delusions. Those are all positive, so they're added. Negative are things you can remember by the 5 A's. So we have apathy, anhedonia, a flattened affect, abolition, and asociality. So olanzapine would be incorrect. Haloperidol, this is actually the correct answer. So remembering haloperidol is a typical antipsychotic and can be given intramuscularly, can be given really quickly. It is proven for the use in acute agitation and violence. It works well for acute psychosis in schizophrenia, and it's usually used in the emergent controlled setting. And then we obviously have clozapine. This is not usually used in emergencies, has a slow onset of action. It's usually for treatment-resistant schizophrenia. And remembering with clozapine always comes up in exams, features of agranulocytosis. So they always say to do a complete blood count, usually weekly. So we can see that haloperidol is the correct answer here. And has a great explanation here, as you can see, go through everything that we said. If you want to pause the video and read through that. And it also gives great references, which I also like about this question bank. And you can go and check them out, and they're all Australian and New Zealand related. So thank you guys very much for tuning in. If you like the videos or if you want access to the question bank, let us know. We're going to start to put up potentially some discount codes and things like that. But yeah, we'll see you in the next video.